Dr. Narayanan, Dr. Ravi Gupta, and friends. I'm very glad to have the opportunity of meeting with all of you today. I'm a little familiar with Dr. Ravi Gupta's work from the time I used to work in the Ministry of Human Resources Development, and I hadn't realized then that he was equally active in the field of healthcare, and it's a pleasure to be here this morning. I would just like to leave a few thoughts with you. I don't necessarily have any definitive answers to some of the big questions in the area of providing healthcare in India. But I do have some thoughts which I would like to leave with you. I think first of all it is perfectly clear, in the presence of such senior and experienced people from the IT sector in today's meeting, again makes it clear that there is this enormous and growing potential for IT applications in the field of healthcare. And I'd say it is a matter of pride that we in India are able to demonstrate this. And so whether we talk about the maintenance of data relating to individuals, the other day Mr. San Petrora was calling on our minister, and then he was flourishing his mobile and saying that, his entire health record was available with him at all times. And I'm sure, to all of us in the ministry, this was new. I'm sure this is not new to any of you here, but we hadn't seen anything like this. It was so there is certainly a huge case for information, health and health-related information related to individuals. There is a very, very huge opportunity for hospital administration, hospital management. There is a very huge opportunity for analysis of disease trends, of just hard data relating to illness, disease, and death, which needs understanding. Over the last 2 days, we were in Hyderabad for a meeting of all state ministers of health. And one issue that actually excited a lot of discussion was, what do we know about causes of death disaggregated to possibly the level of a district? And the conclusion was, we actually don't know very much. That we have broad trends. We have an intuitive understanding in some cases of why people are dying. And we have a very fine understanding of how infectious disease works. But if we were to try and get to any degree of specificity, we run up against enormous problems. We had the advantage at our meeting yesterday of the presence of Mr. Jayant Bantia, who is now Principal Secretary of Health in Maharashtra, who used to be Registrar General of India, and somebody who understands the census process intimately. And even he was of the view that at present we are not really in a position to make very accurate or meaningful analysis of the nature of illness and the nature of death. So there are clearly, while there are huge areas where there are IT applications of enormous relevance, there are equally very big issues to be studied, and I have no doubt that there are people in this room and elsewhere who are actively working on these issues, pursuing some of these questions with a view towards improving and raising standards all around. So I say this just as an acknowledgement of the fact that I'm aware without being any kind of expert, but I'm aware of the fact that there is an enormous amount of work that is being done in this area, and there are people doing it, and there is indeed a large amount of big business which rides on on this knowledge and this expertise. Well, having said that, I think we should also remember the context in which we live and work in India. And I think a very good point to start this is some of you would be familiar in the last couple of days. The Lancet series of studies on India has just been released. It was covered in the newspapers. In fact, I would recommend to Ravi that maybe the next issue of eHealth should maybe just have 3 or 4 pages on what the Lancet studies say, because these are researched, evidence-based documents of the highest standard, which make a very, very clear assessment of where we are in India. What is our health status? What are the big issues? Which are our relative successes? It specifically talks about the Janani Suraksha Yojana and the Rashtriya Swasthya Bima Yojana as relatively successful models of public intervention. But there are also huge areas where we have not made much progress. And why I was recommending that eHealth should carry a supplement on this is because I think it is essential that people in your position understand something of the wider context. And I say this, I mean no disrespect. I do not cast any aspersions on anyone's understanding, but it's just that the sense I got very clearly, even as the round of introductions was going around the house, is that most people here, I may be corrected if I'm wrong, but that most people here are on the whole more familiar with the private hospital system. You probably find it much easier to work with the private hospital, and I do not for a moment doubt that that is indeed so. But the fact remains, and this may be an unpopular position to take, but that public health has to be a public responsibility. There is no getting away from this fact that we have world-class standards in some of our hospitals. There is a terrible term which is used of health tourism, but I cannot think at this moment of a more sensitive phrase. But then the fact remains is large numbers of people come to India seeking world standard